Hello, in this video we will discuss about the ARDS, the Acute Respiratory Distress Syndrome. So what is this? Let's begin to understand. It occurs when fluid build up in the tiny elastic air sac, alveoli in your lungs, and the risk of death is high if not treated and damage the lungs and cause the inflammation. Inflammation means the recruitment of the neutrophil and innate immune response, innate immune cell and the adaptive immune cell. For further inflammation will lead to cause the many problem. For example, allergic reaction due to the mast cell. So anyhow, here is the structure, the diagram of the person which that's contain respiratory system. So this is the nasal cavity, pharynx, and the trachea, lungs. This lungs is the two in the form of pair, and this is basically lung contain a tracheole, ultimately divided the left and right trachea into the tracheole, and this tracheole, which that is end of the tracheole, contain alveoli. So the alveolum is the single and alveoli is the multiple. So in this phase, the one alveoli contain many air sac. This air sac contain a space inside for the oxygen and carbon dioxide exchange through blood to the air sac into the exhalation and inhalation. So in this way here is you can see the sodium when move into the airspace and other things due to the endothelial dysfunction will lead to cause the fluid absorption into the lumen due to the increase the sodium ions, which that will lead to increase the water as well as fluid. So here is the causes we will discuss here. The respiration here is basically the carbon dioxide and oxygen exchange. So when build the fluid or pus, or on the other hand the fluid, the water, the mucus, which that will lead to the fluid leak due from the endothelial cell of the blood vascular system. So the blood will leak due to some reason. So in this way, the sepsis, the most common cause of ARDS is sepsis, a serious and widespread infection of bloodstream, which that will lead to cause the ARDS. On the other hand, the severe pneumonia, which that will lead to cause the acute respiratory distress syndrome, and the inhalation harmful smoke and substances, so that is the major cause. On the other hand, the head, chest or other major injury, COVID-19 infection and pancreatitis, and bacterial infection and viral infection or fungal infection due to the cause pneumonia. So this basically is the same like a pneumonia, which that is ARDS. This is the acute respiratory distress syndrome we are discussing in this manner in this video. So here is, let's begin to understand the symptom. So the symptom is many symptoms, but we will discuss just general symptom. So the low blood pressure, and due to the low blood pressure, due to the loss of fluid from the blood vascular system into the lung, and the chest pain. Chest pain is due to the fluid filled air sac, which that will lead to inflammation, severe shortness of breath, and the coughing, labor, the unusual rapid breathing, and that is due to the less or increase the fluid sometime in a whole day. So that is why the rapid or unusual rapid breathing or labored breathing and coughing and take out the basically is the mucus as well as histamine, for example if the allergic reaction, but in this case, and confusion and extreme tiredness, stress. So the risk factor is blood clot is also the risk factor due to increase the blood pressure in the pulmonary circulation near the lungs, and collapsed lungs, a pneumothorax, infection of the lungs, the scarring tissue, the pulmonary fibrosis, and the treatment we will discuss. Let's begin. So when we will admit into the hospital, when the person will admit into the hospital due to the ARDS, so the medical ventilator machine which that is applied for it. For the average patient with ARDS spend between 8 and 11 days on a mechanical ventilator. After this, the objective of the mechanical ventilator to maintain blood oxygen level, which avoiding oxygen toxicity and for increase. So don't increase the oxygen, but the normal. And the complication of mechanical ventilation can be occur. On the other hand, we can provide the drug treatment. So the sodium pump for fluid clearance also required due to the increase of the sodium in the blood circulatory system, which that will absorb the fluid into the blood circulatory system from the air sac. And here is the blood pressure when increase, it means the lead to ARDS, acute respiratory distress syndrome, due to the leak of the blood vessel for and fluid will be into the air sac. And on the other hand, the aerosolized prostacyclin is the vasodilator, and the prostacyclin E1 is the downregulator of neutrophils and activation and vasodilation. And the corticosteroids increase the sympathetic nervous system for increase the breathe, so the vasodilation will occur. And surfactants also used for it, for the basically the normal recovery phase, for the recovery. So the ARD is the pathophysiology we will discuss. So the exudative phase is the exudative phase means the initial response to injury. After this initial response, the day 1 to 7, the progression of ARDS. In this way, the inflammation damages endothelial and endothelial layer, lead to increase the permeability. And when permeability will increase, it means the fluid will move into the air sac. And when increase the fluid into the air sac, which that is contain bacteria, so cause bacteria infection will lead to pneumonia also. So the type 1 AEC and type 2 AEC cells, which that is basically type 1 AEC will be infect for the, because it will damage to release the inflammatory mediators, and damage due to the water or fluid which that retention. And in this way, the basically is the normal and the abnormal function of the type 1 AEC. And in this way, that increase the AEC cell, which that increase the inflammatory mediators, and the protein rich fluid activated the neutrophil, and the other pro-inflammatory mediators fill the alveoli. So the alveoli will fill with the inflammatory pro-inflammatory mediator, fill the alveoli, and recruit the neutrophil, basophil, mast cell for the innate immune response to clear that debris and clear that proteins, for example albumin protein. So the third step is the alveolar epithelial. The alveolar epithelial cell are injured, and the alveolar epithelial cell when injured, the basement membrane is denatured, and surfactants production and fluid resorption is inhibited, and hairline membrane form, and cellular debris and fibrin will be added. So in this way, as you can see, this the neutrophil, basophil, and the innate immune cell will be increased, and the dead space, which that will lead to increase the dead space due to the death, necrotic death of the cell, the epithelial cell of the air sac and hairline membrane, which that is the scar formation. And in this way, here you can see this is the step 4 is the endothelial damage, triggers the coagulation cascade, microthrombic compliance can form. So the inhibit gas exchange, increase the death space. Pulmonary hypertension also increase due to the increase pulmonary hypertension due to the fluid increase. And endothelial damage trigger the coagulation cascade, and microthrombic compliance can form. and this was the ARDS.